Hello there, my name's Chris and I'm a registered associate nutritionist here at Edinburgh Community Food. And today I'd like to talk to you about men's health, a subject I feel that sometimes gets a little overlooked when we talk about people's health in general. Now there are various health conditions which affect men more than women or affect us men only. We're less likely to speak about and share our problems than women, and we're much less likely to seek help as well. So in today's short talk, we will look at heart disease, cancers, prostate health, erectile dysfunction and fertility, and finally we will turn to mental health and good mental well-being. Now, men and women's health issues differ due to our differing biology, of course, but also due to different behaviours and lifestyles. We men are, on average, less healthy than women at all stages of our lives. And out of the 15 leading causes of death, men lead women in all of them except Alzheimer's disease, which is a form of dementia. So what are the leading causes of death in men? In first place is heart disease for all ages, but also suicide and accidental death for the age group 20 to 34. These are followed by dementia. And in third place, we have various different types of cancers, which include, but it's not limited to, lung cancer, bowel cancer, leukemia, that's blood cancer essentially, lymphatic cancer, and prostate cancer. We men are also more likely to drink more than our maximum 14 units of alcohol per week. We're more likely to smoke and be overweight or obese. We're much more likely to have heart disease, and we're 3 times as likely to commit suicide, deeply worryingly. We die younger, we report lower levels of satisfaction throughout life, and we're more likely to go missing and sleep rough. And as I said before, we're less likely to talk about and share these issues, seek help, and visit GPs. We're more likely to eat meat and to overconsume saturated fat, salt, and sugar. We're less likely to consume enough fruit and veg, and we also do not consume enough oily fish or dietary fibre. So there's a lot of rather gloomy, depressing information there, so apologies about that. However, I would like to point out that there are things that we can do. So it's not all doom and gloom. There are positives here. There's changes that we can make today and tomorrow to improve our health. Now, I'd just like to take a minute or two to look at this, the Eat Well Guide. And this is the British government's guide to support us to have a healthy, balanced diet. And just going through it very quickly, I'd like to bring our attention to the green and the yellow sections in particular, because we'll focus a little bit more on these throughout the rest of the talk. Now, the large green section, which makes up over 1/3 of the Eat Well Guide, is for our fruit and vegetables. The yellow section, again, over 1/3 of the Eat Well Guide, is complex or whole grain carbohydrate foods. The remainder of our diet, so a bit less than the last third, would be made up of protein foods, dairy or dairy alternatives, and a very small amount of unsaturated oils and fats. So as we can see from this diagram, and very useful diagram it is too, that at least 2/3 of our diet should essentially be plant-based. It's fruit, it's vegetables, and it's carbohydrate foods, excuse me. Okay, now turning to the particular health conditions, and let's start off with coronary, or sometimes called ischemic heart disease. Now this is the leading cause of death in men, and it's caused by something called atherosclerosis, which is when cholesterol narrows our arteries or even closes them, causing reduced or stopped blood flow to the heart. The symptoms of this include extreme fatigue, dizziness or fainting, shortness of breath, chest pain, otherwise known as angina, heart palpitations, swelling of the legs, feet, or abdomen, pain in the neck or in the jaw, weight gain, and nausea. But remember, we're looking at positives here. There are things that we can do to help ourselves. So we can work to reduce our blood pressure. We can do this by reducing the salt that we consume. We're meant to have no more than 6 grams or a teaspoon roughly of salt per day. We can consume more dietary fibre, so that's more of the complex carbohydrates, fruits, vegetables, and also pulses. Manage our weight and try and keep it as healthy as possible. Increase our physical activity levels and also reduce or quit alcohol and smoking. Secondly, we can try to reduce the cholesterol in our blood, and we do this by reducing the amount of saturated fat that we consume. We can also reduce it by consuming more oily fish and oat-based foods. We can manage a healthy weight, and again, increase physical activity and reduce or quit alcohol and smoking. Now please remember there are free health checks available in Scotland to all aged 40 to 64 via your GP. Cancers are the third most common cause of death in men. Skin cancer, although rarely fatal, is also more common in men than in women. In cancer, cells in a specific part of the body grow and reproduce uncontrollably. The cells can then invade and destroy surrounding healthy tissue, including our organs. So what are the symptoms of cancer? There are various symptoms, and we may not have all of them. We may have an unexplained cough for over 3 weeks, changes in bowel habits. So for example, we might see blood, we may experience pain, there may be unexplained diarrhea or constipation. We may feel bloated for over 3 weeks. There may be blood upon coughing, vomiting, around our bottom, in our stool, or in our urine as well. We may find lumps, for example, in our groin, in our testicles, or under our arms. We may experience unexplained weight loss. And in terms of skin cancer, we may have changing moles. So do we have new moles? Are they changing colour? Are they growing? Are they becoming raised, flaky, or itchy? Please contact your GP if you experience any of the above symptoms. And I'd like to point out that NHS bowel screening kits are sent every 2 years to everyone aged 50 to 74 in Scotland, so please do make use of them. Prostate cancer. Now, what is the prostate? Well, we can see in the image in the bottom left of the slide there, a prostate is a small gland, roughly the size of a walnut, somewhere between the penis and the bladder, and it produces our seminal fluid, not the sperm, just the fluid that the sperm sits in. What are the symptoms of prostate cancer? An increased need to pee, straining while we're peeing, and feeling that our bladder has not emptied after we've peed. Now, these symptoms should not be ignored, but they do not mean that we have prostate cancer, okay? But it's very important that we do get them checked out by a GP to make sure. Okay, so what else can we do around cancers? So it's going back to the Eat Well guide, which we can see again in the bottom left of this slide here. At least 1/3 fruit and vegetables and 1/3 complex whole grain carbohydrates, which happen to be low in saturated fat, but also very high in the all-important dietary fibre. We should increase our physical activity and reduce and quit alcohol and smoking. Maintain a healthy weight. Check for symptoms and regularly check for lumps, which can be something we do every time we have a shower or a bath. Okay, so not prostate cancer now, but thinking about an enlarged prostate, a separate and much less serious condition. It's also really, really common in men over 50. It's not a cancer and it is not life-threatening, and it does not increase your risk of developing prostate cancer. What it does do, though, is it affects how we urinate and can cause real discomfort or even pain. So the symptoms are experiencing a difficulty starting to pee, having a frequent need to pee, a weak flow, feeling that our bladder is not emptied after we pee, and urinary incontinence, i.e. we can't stop going. Now, the causes of enlarged prostate are unknown, but only some cases require treatment, the more serious ones. Please contact your GP if you experience any of the above. And again, there are some things that we can do to help. So reduce alcohol intake, along with caffeinated drinks and fizzy drinks. Limit artificial sweeteners, and please be aware that this isn't just Sweetex for teas and coffees, but there are sweeteners in a whole range of foodstuffs, so drinks and packaged food as well. Try to exercise as much as possible and drink less in the evening. I don't only mean alcohol here, I mean any liquid in general. Medication may be prescribed in more serious cases if the above steps do not help, but for many people with a less serious enlarged prostate, the above steps are very beneficial. Now turning to erectile dysfunction and male fertility. Now, erectile dysfunction is a really common condition, especially in older men. Around 50% of us aged 40 to 70 have it to some degree, and 25% of men under 40 will also have it to some degree. It's usually a temporary and very much a treatable issue. So what causes erectile dysfunction? There are several causes, but a key one is a narrowing of the blood vessels going to the penis, so less blood flows there. And this can often be associated with having high blood pressure, high cholesterol, or diabetes. Other causes include hormonal problems, surgery or injury, anxiety, depression and worry, relationship problems, and finally it can be a side effect of various different types of medication. What can we do? Firstly, please don't panic. It's very common. 50% of men over the age of 40 experiences it, so that's 1 in 2 of us. Seek a diagnosis. It is really important to understand what causes each individual's case of erectile dysfunction, because the treatments or support and advice will vary a little bit. Maintain a healthy weight. Follow the Eat Well guide and get that nice balanced, healthy, nutritious diet. You could consider cognitive behavioral therapy or sex therapy. But also, of course, there are well-known medications available, so again, please speak to your GP. Sadly, male fertility is actually declining across the UK over recent years, suggesting environmental and lifestyle causes to this. But that notwithstanding, there are some things that we can do to support better fertility. And you'll see a lot of repetition here. A lot of it comes back to physical activity, alcohol, smoking, and the Eat Well guide. So once again, follow the Eat Well guide and try and eat as much fruit and veg as possible, at least 5 a day. Maintain a healthy weight and keep physically active. According to the NHS, adults of our age should be going for 150 minutes per week of physical activity, or you can break that down to about 30 minutes across 5 days. Try to avoid having very hot baths or showers and tight clothing. And of course, reduce and quit alcohol, smoking, and recreational drug use. And now for the final part of our talk. We're going to look now at mental well-being and mental health. And we're going to consider mostly, I think, depression, anxiety, and stress. We all have mental health, just as we all have physical health. And just like our physical health, our mental health is better at some times than it is at others. There is no separation between mind and body. That's a very simple, old-fashioned idea. Our brains are simply another organ within our complex bodies. So what are the symptoms of mental ill health? Well, there are lots of them, and some of these we will experience for several days or a week or two. It doesn't necessarily mean we're unwell. It's when more of these come together and they last for longer. So symptoms can include feeling irritable, angry, aggressive, or if people notice changes in our character. We may start to lack, taking care of ourselves. We may lose interest in our lives, our friends, or our hobbies and pastimes. Other symptoms could be increased use of alcohol or substances as we try to manage our feelings, feeling overwhelmed, feeling tearful, experiencing changes in appetite or in weight, loss of sex drive, disturbed sleep, risk-taking behaviors, and self-harm as well. Now, as I say, we may experience these in short, brief amounts, and that's okay, nothing to worry about. However, please do contact your GP if you experience symptoms continuously for over 2 weeks. But again, what can we do? There are things that we can do. And first and foremost, and I can't underline how important this is, we should talk. We men are notorious for suppressing and ignoring our feelings. And the best thing we can do is to open up to a friend, a partner, a relative, a colleague. That first step can seem enormous, but it's so beneficial and so helpful. The simple act of opening up and sharing an issue really takes away an awful lot of its power, if that makes any sense. And if talking to a friend or a partner feels too difficult, there are many counselling options available. In Edinburgh alone, but across the rest of Scotland, there are lots of free services, subsidised, very affordable services, and of course full price paid for services as well. And in case you may feel worried about opening up to a woman, there are lots and lots of male counsellors, and the numbers are increasing year on year, month on month almost. There are a couple of links here, but in case you don't have time to write them down, all you have to do is Google free or subsidised counselling services Edinburgh men, and you'll get links to a bunch of different resources. Second top tip, cry. Boys don't cry. Be a man. Tears are for wimps. Don't be a girl. We've all heard these phrases. They're at sports class at school and throughout life. Some people refer to this as toxic masculinity, where we're educated not to be emotional and not to show our emotions. This is ridiculous. Everyone has emotions, and it is normal and healthy to experience them and also to cry. When we cry, it helps to release tension. There's a reason that we do it, a reason that we're able to do it. What else can we do? Okay, if things are getting really dark, we could try speaking to Samaritans, absolutely anonymous, and each time you phone, you will get a different Samaritan as well. We can write or keep a journal. So if talking's a little bit difficult, then perhaps we can talk to the page, as it were, talk to a diary. Be mindful of how we manage our feelings as well, and this is quite important. So harmful ways of managing our feelings might include alcohol use, drugs, increased smoking, experiencing anger, aggression and violence, self-harm behaviors, or other addictions such as gambling or risky sex. So being mindful of these and then thinking, well, what are the beneficial ways that I might manage my feelings? Through talking to a partner or a friend, or writing in a diary, trying to get as much physical activity or exercise as possible, doing my normal daily activities, the fun ones as well as the standard chore-like ones as well. It's keeping as much of a sense of regularity and normality as possible. Seeing people, trying to get outside, especially into what they call green space, i.e. a little bit of nature. If you live next to a mountain, fantastic. However, most of us don't, so it's a public park and making best use of that. If we do have a partner or people around us, being intimate with them, and if we're able to, having sex with our partner is really quite beneficial too. Are we able to identify triggers? Are there particular things that make us feel depressed or anxious or stressed? And if so, is there anything we can do to address these triggers, to change them, to remove them? And of course, finally, we should always speak to our GP for additional help, because there is additional help available. Now, I don't know about you, but I, for one, am very much an East Coast Scot. Have never been terribly good at expressing myself or my emotions, and having had on and off over the years my own issues with mental ill health and depression, I have found this really a really useful tool, and thanks to my very understanding and long-suffering partner who's worked through this with me on a number of occasions. So if you, like I, find it quite difficult to express yourself, then I found this absolutely invaluable. So I can sit down, look through the words and go, oh yes, I'm feeling this today and that today. It's also very useful for using with any younger people we might work with as well. So teenage boys in particular, if we've got adolescents at home, this can be really beneficial to get them to open up. So mental well-being, but thinking in terms of nutrition now, what can we do? Well, firstly, there is no silver bullet. Despite what you might read on the internet and certain websites, A healthy diet and no kind of secret magic health providing ingredients, none of this will prevent or cure mental ill health. However, it may help to improve symptoms. And we can say fairly certainly that an unhealthy diet is likely to worsen the symptoms that we feel. So here's the mental well-being and nutrition topic in an absolute nutshell. The food which is good for our body is exactly the same food which is good for our minds, our brains, and our mental health. And one crucial thing that we can do here is support our healthy gut bacteria, because we know from studies that the bacteria that lives in our guts, in our bowel or our colon actually, provides up to 90% of our feel-good hormones. So I'm talking about serotonin and dopamine here. If we have a very healthy gut bacteria, they produce enough serotonin to keep us feeling cheerful, content, and happy. So how do we support our gut bacteria? I'm not suggesting we all rush out and buy very, very expensive probiotic capsules. No, we can support our gut bacteria by, again, and this may surprise you, following the Eat Well guide, at least 1/3 fruit and vegetables and 1/3 complex whole grain carbohydrate foods. Okay, I'm bringing us to an end now. Men's health, in summary. Follow a healthy balanced diet with lots of fruit, vegetables, and complex and wholemeal carbohydrates. Reduce saturated fat, salt, and sugar. Reduce or quit alcohol, smoking, and other substances. Increase oily fish and dietary fiber. Maintain a healthy weight. Increase physical activity as much as you can. And talk and be open about our feelings. Okay, I hope that's been some help and of some interest. So thank you very much for listening to me today. All the best. Goodbye.